Hello, my name is Dr. Gandhi, and I'm a GP at Wellspring Surgery in St Anne's, Nottingham, as well as Clinical Director of Nottingham City East Primary Care Network, or for the purpose of this stream, we're going to be calling it PCNs because that's their shorter name. And in this session, we're going to be talking about what exactly is Nottingham City East PCN, try and give you a flavour of what basically we're trying to achieve across our local patch and how we can help support our patients and our practices across the entire footprint. To try and help with this, I have got some simple slides just to bring up, and we'll bring them up right now so you can have a little look-see. And this is basically going to be talking about what we're trying to do in Nottingham City East. I think before we do that, it's worth talking a little about what exactly is PCNs. So, in terms of what a PCN is, these are groupings of GP practices that was created a couple of years ago at the direction of NHS England as part of the GP contract, and they're normally groups of practices in typically the same geographical area. This is basically to try and provide an additional route for services and other care in terms of what's happening in your local healthcare. Typically, there were suggested to be about 30 to 50,000 patients based off previous evidence, and there are some that are smaller, and there are some that are larger, considerably larger. We'll get to that in a second. The aim of the networks is, as I said, to collaborate between practices, but then also work with other local providers in the community and systems to try and enhance the care that is being offered to patients across general practice and primary care. The main funding that they have in order to do this is through something called the Additional Roles Reimbursement Scheme, providing basically additional workforce. And we're going to be talking about what workforce we have across Nottingham City East in a short while. And one of the key things that has changed, obviously, over this time is that COVID came along and changed absolutely everything when it comes to healthcare, and in particular, how the PCNs were designed and delivering care. That absolutely changed as a result of COVID. And one of the key things that they have been supporting practices with is the delivery of the vaccination schemes across the entire country. So some networks have taken this on completely, some where they've been supporting their practices deliver it towards our patients, and that's why we've seen 75% delivery through general practice and primary care, which is absolutely awesome, and various other parts of care as well that's happened at the same time. So it's going to be interesting to see what makes up a particular network. So things to know about our particular network is that we are a collaboration of 7 different practices. Now, this has changed slightly over time, but currently we have 7 different practices, which include Bakersfield Medical Practice, Greendale Primary Care Centre, Parliament Street Medical Centre, Windmill Practice, Family Medical Centre, Victoria Mapley Practice, which is a 2-site practice, and the Wellspring Surgery, where I currently work from. And these various practices have been collaborating together even before PCNs came together, but more formally since the creation of the Nottingham City East Primary Care Network, and contribute to both the way that the network works, providing resources, support, and various other things. And if it wasn't for our member practices, to be honest, we wouldn't be able to do a lot of this. We do collaborate with other partners. In particular, we've got our Nottingham City General Practice Alliance, so the NCGPA, which provides a lot of healthcare services across Nottingham, and in addition with our local LMC, local CCG in terms of the way they're delivering things, and absolutely partnering with our other networks in the local areas, so covering the different geographical areas across Nottingham. We also work with various other community providers, and if you want to see more information about that, check out some of our latest streams, particularly the ones talking about innovation and stuff. But where exactly is Nottingham City's PCN? Well, this is a picture, and I'm going to enlarge this for you so you can see a bit clearer on the stream. So this is basically where Nottingham City East PCN is. It's a map of the Nottingham City area, and as you can see, I've identified the various different practices that are on there. So we've got the Mapley practice, which, as I said, was 2 sites across the different areas. We have the Nottingham NCGPA Upper Parliament Street practice, which technically geographically is outside of our area, but they have taken on the patients that were based at this practice, which was NEMS Platform 1, and this change happened earlier this year in 2021. We have the Windmill Medical Practice, and then Bakersfield Medical Practice towards the outskirts, and then essentially we've got Wellspring Surgery, Family Medical Centre, and Greendale Primary Care Centre. So that's the geographical makeup of Nottingham City East. What would be useful to know is what are the priorities of our network. And in terms of looking at that, has always been our priorities of what we're trying to achieve across Nottingham City East. So this was a document created about a year or so ago, looking at the aims of what we're trying to do. And the key message that we would like to push across is that we're here to try and support our patients in our network from starting well, living well, and aging well. And in terms of doing that, recognizing some of the real challenges that we have. Across our network footprint, so I mentioned that some networks are larger than the 50,000 that was recommended. We're actually 66,000 and a little bit more in comparison to other areas, and actually the largest network in the Nottingham City area. You can see what that Nottingham City area looks like by this little picture here. As you can see, Nottingham City East is just on the outskirts on the east side of it. And what we're aiming to do is to prioritize healthy lifestyles for our patients because we know that has real challenges for them, to develop a resilient and effective primary care service because we know that if primary care isn't functioning effectively, then that massively impacts the healthcare that patients have and they receive and the general health of our local population. And also working closer with both our patients, the citizens, and the other community providers to try and deliver better healthcare and key focus on trying to detect earlier health issues, particularly along the lines of cancer and mental health challenges across our footprint. The reason we're doing this, well, we've got a really diverse mix of patients. We've got a higher percentage of Black, Asian, and minority patients across our area than most other parts of Nottingham. We know that the health expectancy of patients living in our area is considerably less compared to the England average. And if you compare that to other areas of Nottingham, even just those a couple of miles away, there's a significant difference in potentially even 10 years difference of life expectancy. That is clearly an element of health inequalities that we are keen to try and address and change. And for that in particular, we were hoping to focus on how we can tackle health inequalities and particularly trying to create services for the more specialized areas of healthcare, particularly for those with homelessness issues, asylum seekers, substance misuse, and various other challenges that our patients have to face, and we're keen to try and support them in doing so. So, in order to do that, one of the key mechanisms is having something called the Additional Roles Reimbursement Scheme, and this is an additional workforce to try and help us deliver this kind of care. Over the past few years, we have increased this workforce significantly from what was started. Originally, we only had one social link worker and we had only one clinical pharmacist working across 7 practices and 66,000 patients. This has grown over the past few years with the increase in funding that we've had and the increase in resources to try and deliver this. And our hope imminently for this month, so this is dated in September 2021, we will have 4 clinical pharmacists, 4 physicians associates, 3 social link prescribed workers, 3 first contact physiotherapists, 2 health and wellbeing coaches, a PCN safeguarding care coordinator, a pharmacy technician, and a manager to support the care across our footprint. And we're actually hoping to increase this even further over the next few months, depending on workforce conditions and also trying to find the individuals to help our patients as well. This is really exciting stuff that we're hoping to extend into and basically provide these various resources across the area. And these resources will be seen by patients in their practices, from the different nodes of our 7 different practices that work with Nottingham City East. And I guess the reason why we're doing this, well, this is what we hope our workforce will actually look like. So again, I'm just going to enhance this picture so it looks a bit clearer for you. There we go. So if you imagine at the center of all of our workforce plans is the patient, they sit front and center for all the care that we're trying to deliver and supporting them. We have our 7 different practices trying to deliver obviously the care that they do. And in order to support them, we're looking at creating basically 4 effective teams of healthcare workers from the ARS roles. So these include, if we go from the top left corner, the acute care team. So this is things like first contact physios to deal with, musculoskeletal issues in terms of classic things like injuries, back pain, that kind of stuff to help you deal with those. So then that frees up your clinicians like your GPs and stuff to deal with other health issues, but also means that you get targeted treatments at the same time. We're also looking at having first contact mental health workers to deal with some of those acute changes that patients experience and how to manage their health issues, and social link workers that can support you in terms of some of the challenges that you have. In addition, working in collaboration with them is our acute care team itself. So this is comprising of physicians associates as well as hopefully a paramedic once we have the capacity to take that on, to deliver both acute care, both in the practice and potentially outside of the practice, and particularly to our care home support, which is the next kind of category, looking at the top right corner there. So we know that particularly the COVID pandemic has shined a light on the efforts we need to look at to help our care home population. So having dedicated workforce to help support that, as well as collaborating with our pharmacy teams to help deliver further care. And that's where our pharmacy teams can particularly help our practice furthermore. So that's working as part of our practice support team. So in particular with patients in terms of delivering things like medication reviews, as well as reviewing the way that we use medications in practice. I think that's one of the key things that will help support the increase in appointments for patients for other things, but also making sure that we're delivering high quality care when it comes to their general healthcare. Not overusing medications, reconciling them to make sure patients get the right supplies at the best times and stuff, and hopefully having a better experience from that point of view. Collaborating with them in terms of the practices is the network manager, which is an interface between ourselves and the practices to try and deliver all this care, because there's a huge amount of organization that comes into this. And then also working across between the practice and towards the patients, we're looking at creating care coordinators, and particularly the one we piloted and quite innovative for our area is our safeguarding care coordinator, which is looking at how that role can help support some of the challenging issues that face many of our patients and the workload that comes with that. And as I said, at the heart of this is supporting our patients and making sure that they have key support. So, looking at health and well-being coaches to help activate those patients in terms of the way that their healthcare is being delivered, how they may feel they can tackle various changes, such as being more active, understanding their health conditions, being able to change what's going on in their lifestyle to basically make themselves more healthier. And that is part of the practice support team that works with some of these other roles, as well as some of the newer ones we are hoping to expand into. For example, occupational therapists, dietitians, podiatrists are all things we're considering to try and help all of our local patients and things across the area. So in total, I hope that this is our plan, that moving forward, and this is what we're working towards to try and deliver better care for our local population. It's also how we hope to deliver all these services, particularly the additional roles and a lot of the other work that Nottingham City East is trying to do for our patients across this footprint of Nottingham, basically. So I hope you found that useful and effective. If you do want to contact myself, feel free to do so. Do have a Twitter page, that's at NCE PCN, and you can always contact us through that route. Alternately, do subscribe to this channel. It would be really appreciative in terms of getting more updates and stuff in terms of what we're trying to do across Nottingham City East and things. And alternately, if you do want to check out more information about the innovation that we are doing across Nottingham City East, check out this video. It's probably coming up right here. Ultimately, I'm sure YouTube's recommending something else to you. And hopefully, we'll be able to keep you informed of what's going on in Nottingham City East. Thank you very much.